Dr. Derek, what is hepatitis B?
Hepatitis B.
Yeah, hepatitis
Okay.
B.
So hepatitis B is a virus,
Mm.
and when we say, I mean, let me break it down so that everybody will get. When we say hepatitis, the word hepa
Hepatitis.
stands for, I mean, the liver, you know,
Okay.
and then itis. You know, when we say itis, it's mostly in medical terms, it means inflammation.
Mm.
When we say inflammation, inflammation is when it's a phenomenon
Mm.
when the body senses like an ill-defined occurrence. I want to break it down to the
Yeah.
and then the body tends to respond to that occurrence.
Mm.
So assuming something bites you, and then what if it's an ant? It releases a venom or maybe a toxin.
Mm.
The body tries to control that by producing chemical substances through your blood.
Mm.
You know that will go and kind of fight that thing that the body the thing that bite you released. In course of doing that, you see that the place will burn, it will cause pain,
Mm.
redness, and all of that. Those are what we call inflammatory response.
Oh, okay.
So just like how something bites you and then the organism release something, so does it happen when maybe we get any infection, like say viral infections, bacterial infection, fungal infections. The body sense it like it's something that it doesn't want. So
Mm.
it produces things to, kind of kill it off
Mm-hmm.
or control it.
Yeah.
But in course of doing that, we see a lot of changes in our body,
Mm.
fever, chills, all of that. So that
Yeah.
is the inflammation. So when we say hepatitis, like that means there is inflammation in the liver. But because of the B virus attached to it, now we've associated this inflammation to a certain virus called hepatitis B virus.
Mm.
Yes, so that is hepatitis B.
Okay.
It's an organism that is finding its way to the liver and is causing inflammation in the liver.
Okay.
Yeah.
Okay. So, how does one contract hepatitis?
Yeah. So mostly the most commonest ones are through body fluids like vaginal fluids, semen, the one that men produce,
Yeah.
and then blood. These three major fluids,
Mm.
and also through childbirth.
Mm.
Some mothers can transmit hepatitis B through children. And also through contact, like using infected needles
Mm.
and all of that. And that one too is another. And also sexual contact,
Okay.
anal sex, vaginal sex, all types of sexual contact
Okay.
can expose. Yes, so there are some misconceptions with how people contract hepatitis B.
Mm-hmm.
Some people think that if you have hepatitis B and they hug you, or maybe when like there's a sweat and then you, I
On the
mean,
skin.
no,
Yeah.
it doesn't work like that.
Okay.
Even though some of the virus can be detected when you do tests
Mm-hmm.
in some of these fluids, it doesn't transmit through these means.
Okay.
It uses the major fluids, vaginal fluids, semen, or blood.
Okay.
You understand? And then the other means of contact,
Okay.
childbirth, sex, and other things. Yeah.
Okay. Okay. So that's one have that's one get it through kissing as well. No.
Well, yeah, it depends. It depends.
Like maybe
As I
sometimes they
said,
have
saliva,
bruises or
yes. So if
something.
you have bruises in some people already have oral trash,
Mm-hmm.
like where there's wound in their
Yeah.
mouth, and then also some people have bleeding gums and
Mm-hmm.
all of that.
Yeah.
You would never know.
No. Yeah.
So it's like, I mean, for the kissing aspect, there are some kind of
Mm-hmm.
issues with that. In
Mm.
some ways, no, but in some ways too, there can be a risk to it. Yeah.
Okay. Right. There are other questions I would love to ask, but I think it's I don't know.
Oh,
Okay. Okay. So it's an educational program.
yes.
I'll go ahead and ask it. So does one get hepatitis through let's say some people like to um lick their partners, others give BJs and that. Do you get through that as well?
Yeah. I mean, as I said, sexual contact.
Mm.
And when we are talking of the fluids, I talked about vagina
Mm-hmm.
discharge,
Yeah.
the semen, and then blood.
Yeah.
So anything that will expose you to these forms of fluids, it will expose you to a very significant amount of the virus, because the virus are in these fluids.
Mm.
So if you are giving BJ or oral sex,
Yeah.
you are literally exposing yourself to these fluids as well.
Okay.
So it will find its way into your system.
Yeah. Okay. So why I asked these two questions is because people think sexual contact is just having sex.
Yes,
Yeah. So that's
yes,
why I
yes,
wanted us to
yes,
break it
yes,
down.
yes,
Okay.
yes.
So what are some of the symptoms of hepatitis B?
Well, there's a trick with that.
Mm.
There are different forms of the disease.
Okay.
There are people who have so mostly with hepatitis B, if you go to the clinic and you do a test, a normal confirmatory test, and then it's reactive. You do
Okay.
other tests.
Mm.
That's the hepatitis B profile.
Mm.
You do the liver function test, abdominal scan,
Mm.
and other full blood count and all of that.
Okay.
Now, let's come to the hepatitis B profile.
Mm-hmm.
The profile helps us to define whether the viral infection that you have, the hepatitis B, is infectious or non-infectious,
Oh, okay.
in the sense that it is causing harm to your body
Mm-hmm.
and it's been able to overcome your immune response,
Mm-hmm.
or your body's immune response has been able to overcome it.
Oh, okay.
So sometimes if you have somebody who has maybe a chronic non-infectious hepatitis B, this person will have the virus in their system all right and will need monitoring, but will not be able to show symptoms that will be visible to the naked eye.
Yeah.
Maybe when the viral load is high, because ideally, even though you are not infectious, in the sense that the virus haven't really been able to overcome your immune response, it doesn't prevent the virus from replicating, increasing in size. So as the virus keeps increasing, there can be some onset of symptoms.
Yeah.
But the people who have this and they don't really exhibit any much symptom, maybe once in a while they'll feel some pain in the right side of the abdomen here, some nausea, feel like
Okay.
vomiting,
Yeah.
some chills, fever. You understand? Yes, but those who have the acute infectious ones, those are the ones that have the severe and then I mean whether acute or chronic, the infectious ones, those ones they kind of show the symptoms the most. And then we have the decompensated ones, because those are the ones that at a point in time it really affect the liver so much that you are no more dealing with just hepatitis B. You are dealing with a chronic liver disease.
Oh, okay.
So those ones they would experience the severe jaundice, the yellowing of their eyes,
Yeah.
and then yellowing when they urinate too, you see the
Yellowish,
yellow, yes,
yellowish.
urine and all of that. Yes, so there are people who have hepatitis B, they have tested positive, but they are living their normal life.
Oh, okay.
It doesn't have any
Effect on
effect
them.
on them. And there are people too who have it, and unfortunately, their symptoms are really, really aggressive.
Mm.
Yeah. So that.
Wow. Okay. So what are some of the effects that it have? You know, like when you have it, what are some of the damages that it causes in your system?
Yeah. So, as I said from the onset,
Mm-hmm.
we have inflammations. I
Yeah.
explained that
Yeah.
it's when the body sends a foreign object and it's trying to fight it.
Mm-hmm.
You see how sometimes when something hits you, or I mean something hits your hand and there is a sore,
Mm-hmm.
and then the body tries to heal it. In course of healing it, it leaves something
Mm-hmm.
called a scar.
Yeah.
Now, the liver is a very, very special organ, in the sense that the tissues and the cells inside,